How many call representatives does it take to change a light bulb?
I don't know.
I have no idea.
0. They just transfer you to someone who can help. Ah. Well, here we are again today at the Whole You Podcast. Thank you for joining us. This podcast is brought to you by Nebraska Total Care. Nebraska Total Care is a health insurance company right here, local in Nebraska. We take care of literally hundreds of thousands of our citizens across the state. Whether you live in western Nebraska, eastern Nebraska, central, north, south, whether you're young, just born, whether you're elderly, we are here to help you and support you any way we can to attain and maintain your best health possible. So thank you for joining us. And today with us, I have Jamaree Maack and Dee Kohler. Thanks for joining me, you guys.
Yeah, thanks for having me.
Dee is our Director of Member and Provider Services for our Medicaid product. Can you just tell us a little bit about yourself and kind of what you do here at the plan?
Sure. So, been with Nebraska Total Care 4 years now, and I am the leader of the individuals that answer the phone calls, whether it's a member calling or a provider calling, and we are here to help in any way we can.
Fantastic. And Jamaree, you're our Senior Manager of Marketing and Communications. Tell us a little bit about your job and just about your background.
Sure. I have been with Nebraska Total Care since 2016, so right before we went live the very first time.
Yeah, you've been here since the inception. That's fantastic.
And our department manages a lot of the member communications and the resources that are available to members, as well as a lot of the community outreach and events and activities that Nebraska Total Care is a part of.
Okay, very good. Yeah, very good. Dee, tell us just a little bit more. What exactly do the customer service department do? What do your reps that work under you do? When should our members or providers call you, so to speak?
Yeah, so, our aim is to be able to answer phone calls in less than 30 seconds. And I can tell you right now, we're probably closer to the 15-second, which is pretty speedy.
That's fantastic.
It is fantastic. But once somebody gets on the phone, we're going to help them with things like maybe there's a doctor specialist that they need to see, and we'll help them find one that's within their, city or town or proximity that they can get to. Maybe they need help getting to the doctor. And so we might coordinate transportation and things like that to help them get there. So any sorts of things, or just maybe wanting to know whether something is covered. Or we have great rewards benefits that I bet Jamaree knows them all by heart, but that we might help you make sure, have you met the requirement to be able to get that reward. So, and a provider might be calling in to see, whether a claim has paid, or are there certain things that they need to be doing differently to be able to take care of our members. So we're just here to help. We love to help.
Yeah, and it sounds like, you have such a breadth of offerings that you can help with and so forth. That was something that really surprised me. I've been in Nebraska Total Care for about 2.5 years after working in the hospital for 30 years. And I just couldn't believe how much support there is at the health plan level and so forth. And so that's really neat to hear. And Jamaree, we talk about members, we talk about providers. Can you kind of tell us exactly what we mean when we use those terms?
Sure. So a member is anyone who is covered by the health plan. So if they have one of our health insurance plans, and we then basically we pay for their medical care within their benefit package. So we have 3 different products. We have our Medicaid product, which is what we started with first in 2017. And then we have a marketplace plan, which is kind of that mid-level plan. It works really well for people who do not have an employer-sponsored plan, whether they work for a small business or they are self-employed or not employed for some reason and they don't have access to those big plans that employers a lot of times cover. The marketplace is a really good option. And then we have a Medicare Advantage plan, a supplemental plan. Those 2 plans are just a couple years old, but anyone who is covered by any of those plans is what we would call a member. They're a member of our health plan. A provider is any doctors, specialist, home health agency, someone who provides medical equipment, behavioral health, a therapist, a residential facility, any of those medical services that we cover, the people providing those services, what we call providers.
Yeah, that's really neat. It's amazing just the different components. There's so many pieces that work within a health insurance plan, isn't there? And kind of like I described at the beginning, we have the marketplace plan, the Medicaid, the Medicare. So we cover anyone and everyone throughout Nebraska if they need health care and they'd like to join our membership, so to speak, which is really neat. So what exactly, how do we support our members? How do they find out about us? I know we have a website and things like that. What kind of things do we do there?
Sure. So our website is actually very helpful, and I think there's a lot of resources there for people to access. But when someone is a brand new member, we do try to get resources in their hand right away. So an ID card and a packet of information is mailed out. They're in members' hands within 10 days. So those are out very, very quickly, put in the mail. As long as we have the right address or the right information, we're getting that out to them. Then we supplement that information with emails and text messages and phone calls. So a text message and an email go out within the first day that says, you're covered, we're happy to help, please call us if you need assistance. It's going to direct them to Dee's team, direct them to our website and all the resources that we have available there. Because people don't have to wait for their ID card to get care. They can start seeing a doctor right away. They can schedule an appointment very quickly, and we want them to. We want people getting in to see a primary care doctor as quickly as possible and get that relationship established and start getting care, even if they're healthy, even if they're not having these symptoms, they don't feel like anything's wrong. We want people to get in for a well visit and get started with care right away.
That's what people, I think, don't realize, that they think about, okay, health insurance company, they don't want me to use my insurance. But we do. We want people to get in and see their doctors, even if they're healthy, do the health maintenance, if you need vaccinations, if you need those cancer screenings. So, Dee, you mentioned a little bit about when people call you. What would you say, like, the most often phone call from one of our members, what do they need? What do they desire? What do you guys do most of the time? Or is it just a real big variety?
It is. It changes maybe month over month a little bit. But I would say for the member side, probably one of the biggest things is that they want to make sure that their provider is on their ID card, because that's where their access to care is. And so we'll make sure that that's happening for them. Or maybe they've moved, and so they need to find a new provider, and they're not familiar with that community. So we've got, a way that we can look by their zip code and, where it is that they live in proximity to the different providers that they're looking for. But I would also say that the rewards program is something that we really like to promote, because, who doesn't want an extra little bit of cash, to be able to spend, because I am doing making the choices to go to see my doctor, get my vaccinations, get my health screenings and things like that. So it's encouraging those, and that's where we call it gaps in care. So we're going to look at those things and remind our members that, hey, did you know that you're due for, a cancer screening or whatever it might be, and to help promote that healthy lifestyle that we want for our members. When our providers are calling, it's usually about a claim being paid. It's just a question, and usually it's a pretty easy answer, and maybe they didn't file the right code or something like that, and we can help them walk through that. But I will say probably one of our favorites that if my team was going to be here today, they love helping kids. They love making sure that the kids are getting the care that they need, and that, we're identifying any opportunities that could be even helping that child different than healthcare. Is there a community service event that they might be able to go get a free toothbrush, or some free toothpaste, or something like that. And that's why partnering with Jamaree and the marketing community group is so important, because then we have an idea of what might be going on in the different parts of the state, so we can try to promote those things as well.
Yeah, those value-added services, I think, are so important, and like you say, who doesn't want another $25 to spend, on some healthy food or some medication over the counter or something like that?
So maybe we should describe that just a little bit for
please
people who don't know.
Yeah.
So I think it's really important to note, we're primarily, the rewards program crosses multiple product lines. So when we talk about Medicaid specifically, there are 3 different Medicaid plans, and the basic benefits are the same across the board because the state of Nebraska, Medicaid long-term care, decides what those benefits are and sets them. So no matter who you have, your hospital, your doctor, those primary medical things are going to be covered. But then every plan has some additional benefits, and we call them value-added benefits that members can access. So the program that Dee is talking about is called My Health Pays, and basically there are certain preventative care activities like seeing your primary care doctor, having a mammogram, a colonoscopy, things like that, that if you do those, then money is put on that debit card. And the debit card, once you've earned a reward, is mailed to the member, and just additional funds keep getting put on it as they participate in those behaviors. And then they can use that card for at Walmart and for a variety of different things. And all that information is on our website, so it's available to get
The
more
other
information.
really important one that I think of often is, the pregnant people in our plan. And we really want to encourage them to let us know as early as possible when they become pregnant, and that way we can support their healthy pregnancy and make sure their baby goes to term, have a healthy baby, and so forth. And so there's some value-added things there with our Medicaid plan, right, as well.
Yeah.
Yeah.
And with Ambetter, the Marketplace plan, they also participate in My Health Pays, so it's available there as well. And then the Medicare plan is a little different, but there's some similar programs as well.
Yeah, very good. And that's all on our website. And so if you have one of our various plans, you can look that up fairly simply. Or if you have questions you wanted to explain, call Dee's team, right?
There you go.
Yeah, that'd be great. So you talked to Jamaree a little bit about, okay, how do other members look up on the website and this and that? Now we have kind of a website or what we call a portal for providers, right? Can you describe exactly kind of how we communicate or interact with them?
Sure. So the website, of course, is all public information. Anyone can access it. But for both members and providers, information that is private includes, protected health information. Of course, we need to protect that and keep that secure. So you can then log into either the member or the provider secure member portal and get more individualized information there. So it will have claims history, what have you, what has been paid for that member. For the member, they're going to see their full claims history. For the provider, they're going to see just their history, and so know what's there. So providers can do most of what they need through the portal. I think they submit claims, and they can refer to care management.
If they need to do like a prior authorization, the high, an MRI scan of the brain or something like that, or some sort of a procedure, they can put that in, and so our team looks at that, right?
Yeah.
Yeah.
So, not everyone likes talking on the phone. Dee's team is delightful to call and talk to, but if that's not the preference, then we want to make those digital options available too, if that's someone's preference. So whatever feels most comfortable to that individual, they have those resources available.
Right. Very good. So Dee, if a member calls and they're like upset, or a provider calls and they're upset, what is the process that your team goes through to try to resolve that?
So if maybe they're not happy about something, and we could make any kind of story up. So they're expressing dissatisfaction, and so at that point we would listen to what is going on, and we would be able to document that, and then we would then send that information over to one of our other teammates who handles what's called grievance and appeals. And so depending on the type of dissatisfaction, that team would then make the determination on which route it needs to go. And then they would be following up with that caller or that person, whether it's a member or a provider, and they would be able to kind of investigate, do some research, find out what happened, what's going on. We might want to listen to a phone call or two. We might want to reach out to the provider. But that team specializes in taking care of those things. We also have, where we also have a nurse line or a crisis line. If somebody is in right now, I'm really afraid, or there's something going on in my situation right now, we can help that member get to a nurse for immediate crisis intervention and things like that. And my team has been trained to listen for those types of opportunities so that we can then channel them to the right appropriate person to help in the moment.
Yeah, for sure. I know your team's trained. I've heard you talk about we try to do just kind of a one-call resolution, right? So we don't have to pass people on like my silly dad joke and so forth. And I know your team takes care of a lot of that right away. But if we need to dig deep further and go the next extra mile, we do that.
Exactly.
Yeah.
We have a great team at Nebraska Total Care. I've also been working in healthcare, hospitals, other places for over 30 years, and Nebraska Total Care is top notch.
That's fantastic to hear. Yeah, very good. So Jamaree, we talked a little bit about, our members and our providers and what we do within the plan and on our website and so forth. I know your team actually gets in the community quite a bit as well. Tell us a little bit about those outreaches.
Yeah, absolutely. It's something that is really important to Nebraska Total Care. We talk about we're available by phone, we're available digitally, but we also want to be available in person as much as possible. So we do have people on my team, and basically their whole job is to be engaged in community. So, and they're very good at it. So if there is a local health fair or community event, then they want to be there, and they are out with our materials, and it gives us a lot of opportunities to talk to our members, that they approach us and say, oh, I have Nebraska Total Care. Can you help me with this, or where do I go for that, and get information out right away. Or just people who are like, don't understand, or what is Nebraska Total Care, or we get a lot of people like, oh, I don't have health insurance, how can I get some? So of course we want to make sure people have coverage and don't find themselves in a crisis without coverage, so they can help with that as well, direct people to the right places to make applications. But then they're also working with all of our community partners who are serving other needs for our members. Maybe they're helping with housing or food or many things. Then if that individual goes to them and says, I know I usually come here for food, but I really need help with something health related, those community partners know who we are, and they know who to contact, and they can get members in contact with us. So when a member doesn't know who to call, they do have a trusted partner who is familiar with us. And so those relationships are really important, because we don't work in a vacuum. None of our partners do, and so we really need to be working together, and it's important that we have those relationships built.
Yeah, and I know Nebraska is a big state, east to west and north to south. And I think the neat thing is you have representatives that cover the state throughout. We get out to different community organizations and events. It doesn't matter, where people live. You may find us, right? Right.
Yeah. And how we serve a member in Omaha is different than how we serve a member in Kearney or McCook or Lexington or South Sioux City, wherever. So it's important that we have people who are kind of experts on all of those committees or those communities, so that we don't
have that local knowledge.
Yeah.
Yeah, it makes a big difference. And I think we kind of pride ourselves for being local and really getting in there in the communities and supporting our members and actually our non-members, whoever we can. Our journey, our mission is just the better health of Nebraska as a whole, right? Yeah. Anything else, you guys, that you might want to tell us about your departments or your...
I will say, Chris, one of the things that we are really proud of too in customer service is we also have hired outside of, even though our offices might be located in Omaha, but we have employees in Hastings and Waverly and things like that, and we love that. Yeah. We love that our customer service reps, that we're able to work virtually, so that we're able to be there and have that little bit of local presence too, but also to support the jobs in the state of Nebraska. To be able to be hiring remotely is definitely a benefit for us.
Yeah. That's really
And just to brag on your team a little bit too, customer service also has some Spanish speaking
That's right.
representatives, which has been incredibly helpful for members. It just we can always get interpreters on the phone, and we're happy to do that, but to eliminate that one extra step makes communication a lot easier, and I think that has been incredibly valuable.
Agree. Thanks, Jamaree.
Yeah.
Yeah, very good. Well, really appreciate you guys coming by today and kind of informing us about your departments and all the great things that are going on in Nebraska Total Care. And thank you for joining us for another podcast, the Whole You podcast, brought to you by Nebraska Total Care. We're here to just support you any way we can in your health journey. Have a great day.